In a bid to raise awareness on non-communicable diseases, local non-profit Lake Health and Wellbeing will be hosting a series of activities to mark the Global Week for Action on NCDs, which runs from September 18th to the 25th. Abby Beghno of Lake Health and Wellbeing, speaking with SKN Newsline, highlighted the importance of observing this week.
The Week for Action on NCDs is organized by the Global NCD Alliance, and they're based in Switzerland. And the idea of this week is to put the focus squarely on NCDs and to help us understand how we can prevent and control these conditions. So these are conditions like diabetes, hypertension, cancer, endometriosis, a range of diseases that are not passed from person to person. They develop over time, and many of them are lifestyle related. And so the idea behind the week is to raise awareness of how we can prevent and control NCDs, but also to put the focus on action. What can we all do to prevent and control non-communicable diseases?
She also outlined some of the activities planned to commemorate the Global Week for Action on NCDs.
So we're part of the Global NCD Alliance movement, and so we have some local activities planned. So firstly, we are implementing a social media campaign where we're raising awareness of the leadership that's been shown right here in St. Kitts and Nevis. So you'll be hearing from local advocates, policymakers, and NGOs, and they'll be talking about how they're leading on NCDs. We'll also be sharing stories from persons who are living with non-communicable diseases so that we can highlight the impact of NCDs and how they impact people on a daily basis. And then we have an in-person event in Nevis where we'll be screening a documentary that was developed by the Jamaica Ministry of Health on NCDs. And then following that, we'll be having a panel discussion. So that will be held on Saturday, the 27th of September from 4 p.m. to 6 p.m. at NEPAC. And so all are invited to come over and attend and get involved in the discussion about how we can tackle non-communicable diseases.
Meanwhile, Ms. Beghno stressed that more needs to be done at the policy level and through community activism to better tackle the issue of non-communicable diseases.
I think there's still some work to do when it comes to raising awareness. I think slowly people are getting more aware of NCDs and the impact that they have on our community, but I do think there's still more work to do. I still think there are lots of people that need to be reached. I still think as well, there are people that are very informed about NCDs, but then they're not making the lifestyle changes that are needed to reduce their risk of developing NCDs. So we would like people to eat healthily, do exercise, keep active, also take care of your mental health. And these small changes can help to reduce your risk of developing non-communicable diseases. But also to support that, we also need policies around NCDs. And so we encourage our policymakers to introduce effective evidence-based policies to tackle NCDs. So these are policies that, in terms of prevention, they're policies around healthy eating. So things like a sugar-sweetened beverage tax, front-of-package warning labels, a school nutrition policy, restricting the sale and marketing of unhealthy foods in and around schools and also in government institutions. But then there are also policies that can be introduced in terms of physical activity as well, making physical activity more accessible, but also policies around making NCD medications more accessible and things like universal health care. So there's both policy action that we need, but also individual action in terms of people changing their behavior.
Non-communicable diseases, including cancers, diabetes, mental health conditions, and others, are the leading cause of death and disability worldwide. They account for 74% of all deaths and more than 3 out of 4 years lived with disability. Andre Huey, SKN Newsline.